Let's dive into an advanced quiz on neck hemangiomas. I'll pose each question, give you a moment to think, and then explain the answer. Question 1. What's the most common type of hemangioma seen in the neck of infants? A. Capillary hemangioma. B. Cavernous hemangioma. C. Infantile hemangioma. D. Arteriovenous malformation. The correct answer is C. Infantile hemangioma. These are the most common vascular tumors in infants, especially in the head and neck region. They typically grow rapidly during the first year of life and then slowly regress over several years. Their predictable phases of growth and involution make them unique among vascular anomalies. Question 2. What is the hallmark histological feature of proliferating infantile hemangiomas? A. Large dilated blood vessels. B. Hypercellularity with endothelial proliferation. C. Thickened basement membrane. D. Fibrotic stroma with reduced vascularity. The correct answer is B. Hypercellularity with endothelial proliferation. This marks the active growth phase, with dense endothelial activity distinguishing it from the involuting phase, where fibrosis is more common. Question 3. Which imaging modality best evaluates neck hemangiomas? A. Ultrasound with Doppler, plain X-ray. C. CT scan. D. MRI. The answer is D. MRI. MRI gives detailed insights into lesion size, extent, and flow characteristics, with hemangiomas appearing hyperintense on T2 weighted images. Question 4. Which of these is not a typical complication of large neck hemangiomas? A. Airway obstruction. B. Kasabach-Merritt syndrome. C. Hypothyroidism. D. Malignant transformation. The answer is D. Malignant transformation. Hemangiomas are benign and don't undergo malignant changes. However, airway obstruction and hypothyroidism due to thyroid compression are serious concerns. Question 5. What's the first-line treatment for problematic infantile hemangiomas in the neck? Surgical excision. B. Oral propranolol. C. Intralesional corticosteroids. D. Laser therapy. The correct answer is B. Oral propranolol. It effectively reduces hemangioma size and vascularity by vasoconstriction and inducing endothelial cell apoptosis. Question 6. A child with a neck hemangioma has stridor and hoarseness. What's the likely cause? A. Vocal cord paralysis. B. Compression of the trachea. C. Vascular malformation of the larynx. D. Infection of the hemangioma. The answer is B. Compression of the trachea. Large hemangiomas can press on the trachea, leading to airway obstruction. This is a medical emergency requiring immediate treatment. Question 7. Which gene mutation is commonly linked to sporadic hemangiomas? A. CRASB, VEGFR2C, GNAQD, PIK3CA. The correct answer is C. GNAQ. Mutations in this gene are linked to vascular anomalies, including hemangiomas. Question 8. Which phase of hemangiomas features fibrofatty tissue replacement? A. Proliferative phase. B. Involutional phase. C. Dormant phase. D. Malignant transformation. The correct answer is B. Involutional phase. This marks the slow shrinkage and replacement of vascular tissue with fibrofatty tissue, usually completed by age 5 to 7. Question 9. What's the next step if a hemangioma doesn't respond to propranolol? A. Increase the dose of propranolol. Switch to corticosteroid. C. Add laser therapy. D. Reassess the diagnosis. The answer is D. Reassess the diagnosis. If propranolol doesn't work, consider other vascular anomalies like arteriovenous or lymphatic malformations that mimic hemangiomas. Question 10. Which syndrome includes large segmental hemangiomas of the face and neck with other anomalies? A. Faces syndrome. B. Sturge-Weber syndrome. C. Klippel-Trenaunay syndrome. D. Blue rubber bleb nevus syndrome. The correct answer is A. Faces syndrome. This includes hemangiomas along with posterior fossa malformations, arterial anomalies, cardiac defects, and more. How did you do? Let me know if you'd like to dive deeper into any of these topics.